Okay, so why don't we get started? Good morning, my name is Kate Elkington and I'm one of the Grand Rounds Committee co-chairs along with Drs. Jeff Miller and Christine Denny. Welcome to today's Grand Rounds. Before we begin, we just have a couple of announcements. First of all, we will not have Grand Rounds for the next 2 weeks due to the holidays. So Grand Rounds will resume in the new year on January 4th. With the next in our clinical update series, and the focus of this clinical updates will be dialectical behavior therapy. And our speakers will be Dr. Zachary Blumkin, who is the Assistant Professor of Medical Psychology, and also Dr. Beth Brodsky, an Associate Clinical Professor of Medical Psychology, both here in our Department of Psychiatry. This will be an in-person session, and then there will be a light lunch following rounds for all in-person attendees. Now, before I turn it over to Dr. Bradford to introduce today's speaker, I just want to remind and encourage everyone to post questions at any time during our talk using the Q&A feature at the bottom of the Zoom window, which is separate from the chat. If you are a trainee, as always, please put the word trainee in and we'd like to prioritize your questions. And as always, we really appreciate when folks would like to ask the questions themselves, and what we do is promote you as a panelist. And then you can speak directly with our speaker. So at the end of your question that you note in the Q&A feature, you can write "can ask question myself," and I will go ahead and promote you as a panelist temporarily so you can speak directly. Okay, so now I'm going to turn it over to Marie to introduce our speaker.
Hello, everyone. I'm really excited to be here. Dr. Marissa Spann, the acting director of the interim director of the Office of Equity, Diversity, and Inclusion had a conflict, so I'm delighted to host this Grand Rounds, even though I'm no longer officially part of the OHEDI leadership, and really excited. I had the pleasure to get to know Dr. Ackerman-Barger when we invited her back. Was it over maybe a year or two ago? We invited her here, and she gave a really wonderful, as part of Centering Equity in Education forum that we had in 2021, and she gave a really wonderful presentation. Really wanted to have her back in a larger format with a wider audience. So really excited for her presence here today. Dr. Kupiri Ackerman-Barger is the Associate Dean of Health Equity, Diversity, and Inclusion, as well as Clinical Professor at the University of California, Davis, Betty Irene Moore School of Nursing. And she also directs faculty development for education and co-directs the Interprofessional Teaching Scholars for UC Davis Health. Over her career, she has combined her expertise in nursing and education to advance a program of instruction on workforce diversity, health and educational equity, and institutional sustainability. Her research identifies strategies to cultivate the skills and knowledge that healthcare providers, educators, and leaders need to diversify the healthcare pipeline and graduate equity-minded healthcare professionals. Her work on addressing microaggressions, her work in her writings has really inspired me, and I am really excited to just have her talk more about that today. And so just really happy to have her here to present her talk on addressing microaggressions in academic medicine, a path to inclusion. Thank you, Dr. Ackerman-Barger.
It is a pleasure to be here with you guys this morning. I am just going to bring up my screen real quick. The place that I want to start with all of you is just a little bit of background on the research that I've done. I think of myself as somebody who researches inclusion, particularly inclusion in relationship to learning environments. I began looking at the phenomenon of stereotype threat and how our students experience that in schools of nursing, schools of medicine. I am very much a fan of mixed methods. I think that's a great way to look at prevalence, but then also to do a deeper dive into what the experiences are of the humans themselves. So when we were looking at stereotype threat, we were asking people about what triggers the experience of stereotype threat. And one of the things that kept coming up over and over and over were examples of microaggressions. And so as the universe came together, I got grant funding from HRSA, And one of my research partners, Dr. Darren Lattimore, moved over to the School of Medicine at Yale, and we were able to do multi-institutional research on microaggressions. So as we've been sharing information about how students experience microaggressions, one of the best outcomes is people are like, this is not okay. We don't want this happening in our classrooms or in our learning environments. What do we do about it? So in response to that, my colleagues and I created something that we call the microaggressions triangle model. And I am going to share that with you today. We're going to go over some definitions of microaggressions, the impact, and then really get into what do we do about them as they're occurring. One thing that I just want to point out before we get started is that as we're having national conversations about the impact of racism, there are so many conversations that are happening and that need to happen. When I think about systemic racism, I think about the structures, the institutions, and the people that are involved in sustaining and perpetuating racism. This particular talk is not about structural, and it's a little bit about institutional, but a lot of it is about the interactions that happen. So if you're looking for me to give you suggestions on structural racism, this isn't quite the forum. If you're looking for ways that you can be a great citizen, how you can respond to or acknowledge the microaggressions that you've been the source of, this is the session that you're looking for. All right, let's get started with our conversation. I want to be clear about what the goals of the triangle model are. The first one is that it's a humanistic approach. And what I mean by this is that we understand that human beings are both complex and complicated. One of the things that we like to do is to try and figure out what category somebody fits into. Some of the things that we like to categorize are, is somebody a nice person, or are they a mean person? Are they a racist? Are they not a racist? We try to categorize people in terms of gender or race and ethnicity. And those lines can be very, very blurry because human beings are complicated. And it's interesting how we often understand how complex we are and extend that to ourselves. For example, if I were to ask you to tell me about yourself, but you can only use 2 or 3 words, you would really struggle to tell me who you are as an individual, yet we do that to other people. So what we're going to do is explore some of the complexities of human beings. The next one is we are looking for opportunities to promote inclusion excellence. And so this means that when an interaction is happening, that we pause for a moment and we look to see, is there something here that could be a teachable moment? And as we're deciding that, you know, there are going to be times when you're like, yeah, I think that I can do something with this in this moment. And the other decision that you can make that is absolutely okay if you deem that this is the correct way to go is that this is not the time, this is not the place, this is not the power dynamic to do that, or maybe I'm not the person to do that. All of those decisions are okay. They're hard decisions to make, but they're all okay decisions. That's part of that pausing for a second. We want to prevent microaggressions, and as much as we would like to prevent other people from being the source of microaggressions, we actually have no power over how other people behave. So if we are truly going to be folks who prevent microaggressions, we got to prevent ourselves from being the source of microaggressions to the extent possible. And then also when we are the source of microaggressions, to be accountable for that microaggression, whether you intended it or not, whether you were misunderstood or not, you understand the impact of the perceived microaggression and address it. And we will go over that in the next hour. It's also about the idea of repairing and reestablishing relationships. So those people that we work with, that we're learning with or learning from, the patients that we're working with, oftentimes these really are long-term relationships, and they can be relationships with people that we didn't choose to have relationships with, but because of the nature of what we do, we are in relationship. And we want those relationships to be as effective as possible over time. And so that means that there are times when there will be a dip in the relationship. And the hope is that there will be as many, peaks in that relationship as there are dips as you go through some of the learning and growing and getting to know each other. This doesn't mean that everybody has to be your closest best friend, but you do need to be able to work in situations where people feel respected and included. You should be able to feel respected and included in the environments that you're working in. In that last one, restoring reputations, these last two bullet points are actually based in the restorative justice model. And I pulled out restoring reputations because of one of the things that we are in right now is something that you probably know is cancel culture. And I just want you to think for a moment about the impact of being canceled or experiencing that phenomenon. We work for a lifetime to establish our reputations. We have been working on our reputations since we started school. This is something that is very near and dear to us. And just think for a second on social media, how quickly all of that work, all of the good that you have done can be negated in just a moment. And, raise your hand sort of metaphorically if you want it to be blasted out everywhere that you're racist or homophobic or, elitist or any of those sorts of things, right? And so canceling somebody, yeah, that is one of the tools that are in your tool belt of strategies for addressing microaggressions. But I would say that's really the nuclear option, and think about whether that's the one that you want to use. And we are in an environment right now where we need to have hard conversations about who we are as a country, who we are as a healthcare system, who we are as individuals and communities. But when people are terrified that they're going to say the wrong thing or their reputations are going to be destroyed through, engaging in a class or a conversation, people are going to retreat from those conversations, and the work that needs to be done is not going to be done. So what I ask you to do is, in these moments when there are microaggressions that are happening, I want you to pause and think about the goal. Where is it we want to go with this conversation in our community? And is canceling in this moment the right thing to do, or is this a teachable moment? I can't possibly know what those times are. Sometimes it takes me a while to figure them out when I'm, experiencing a microaggression myself. But I just think that we should slow down a little bit with calling people out and calling people in a little bit more. This is an opinion, and you can reject this or, agree with it, but it is my opinion that the majority of people that we work with day to day are well-intended. And I know that intentions don't get us anywhere, but we can actually work with intention. If people have the values, if people want to take good care of their patients and their communities and be a good member of an organization, we can work with that. The people who are not well-intended, those are the folks that I just don't have the time or energy for. I'm not going to try to focus on changing those individuals. Rather, I want to focus on the overall environment and community so that that person's voice is heard less and less, and they get less energy as we have collectively decided that we're moving towards inclusion. So what the triangle model is not. So many people ask me, like if I say this and they say that and I say this, what is the next thing that needs to be said? Humans are not that simple. This is back to that humanistic notion that people are complicated. Things change based on, your mood. Are you hungry? There is a thing called hanger, which can, impact the way that you address a situation. What are the power dynamics? There's no way to have an algorithm. Rather, the triangle model serves as a framework for making a decision. It is not appropriate for every situation. If there is overt racism happening, or if there's discrimination happening, this is a safety issue, and I don't really advocate that you try to teach the person that is attacking you or causing you harm about inclusion. This is a time for you to think about your safety. And we'll talk a little, hopefully you'll understand the difference between a microaggression and overt racism and discrimination by the end of this talk. It's also, when a microaggression is happening, it's not about taking sides and figuring out who's right or wrong. That's actually another binary that is misleading in many ways. Oftentimes there are multiple truths and multiple perspectives that need to be taken into account if we're really going to get to the heart of the matter. All right, so let's just start with acknowledging Dr. Chester Pierce. He was from Harvard University, a psychiatrist. We lost him in 2016, but his legacy remains. The first time that we saw the word microaggression or macroaggression in the literature was in the 1970s in a chapter that was written by Dr. Pierce. When he was looking at microaggressions, he really was focusing on the experiences of African Americans. But since that time, there have been multiple scholars that have taken that idea and expanded it. One of the most prolific scholars in this area is somebody named Daryl Wing Sue. I'm going to share a definition. There are multiple definitions out there, but here's one version of that definition. Racial microaggressions or microaggressions are subtle statements and behaviors that unconsciously or consciously communicate denigrating messages to people based on a social or identity group. So it can be unconsciously done or consciously done. So one of the things that Daryl Wing Sue did is he created basically a taxonomy. And I don't expect you to memorize these or even to try to figure out which one of these is happening when a microaggression is happening, but really to understand the depth and breadth of how microaggressions can occur. So microassaults are usually what we think of when we think of a microaggression. These are those intentional and explicit derogatory verbal or nonverbal attacks. And I just want to underscore that it can be nonverbal, like a good eye roll can, actually be a microaggression. One of the other kinds is micro insults. So these are rude and insensitive, subtle put downs of someone's racial heritage or some aspect of their identity. These are often followed by a just kidding, but that just kidding feels, very false and just like a follow-up as somebody's realizing that what they said was not particularly funny or that they're in a group of people who are not tolerant of that kind of stuff. And then micro-invalidations are remarks that diminish, dismiss, or negate the realities and histories of people of color. So these are folks that will say things like, there's no such thing as racism. My response to that is our science actually shows that systemic racism does exist, and the measurement of that is looking at racial disparities in the outcomes of our different institutions. Like I just challenge people, tell me an institution where there's not a racialized disparity. Is it education? Is it the carceral system? Is it food? Is it housing? Is it transportation? Is it access to jobs? Is it, it must be healthcare, right? There can't be racialized disparities in healthcare. No, every single one of those has the marker that shows that there is disparate treatment based upon race. And then the other thing is when individuals will say, well, I've never seen that before. And of course, that is a very self-centered notion that in order for something to exist, you have to have witnessed it. For example, I'm pretty sure that there's conflict happening between Ukraine and Russia. I haven't seen it, but that doesn't mean that it's not happening, right? And it's the same thing when people are talking about their experiences of racism. Maybe I haven't seen it, but that doesn't mean that it's not happening, right? So another way that Daryl Wing Sue has contributed to the scholarship around microaggressions is he's broken them down into different types of microaggressions. So I'm going to share some of those with you. The first one he talks about is alien in one's own land. So this is the experience that is common to people who may have Asian or Latino, Latinx descent, where they are asked questions like, where are you from? And you might say, I'm from Wisconsin or Bakersfield, California. And people will say, no, where are you really from? And the problem with this is that it implies that if you are not entirely white appearing, that you can't possibly be American. Another one is some comment about the way that a person speaks English, like, wow, you speak good English. Like, that's not a common thing that people just go around saying to each other. That is something that is racialized based on the way that somebody looks. And then the other part of that is maybe it's that you don't belong in healthcare because you don't speak English like I do. All of those are examples of microaggressions. Ascription of intelligence. So this is the notion that people are, more or less smart or intelligent based on their racial identity. And that harkens back to a time in our not so distant past where our country, our scientists, our healthcare system was trying to prove that white people are smarter than Black and brown people. And we still live that legacy in many ways. Some of it is, more on an unconscious level. And some of that is, spoken out loud in admissions committees. That if we keep admitting people from diverse backgrounds, that we are going to be lowering our standards, all of that kind of stuff. So the way that this can manifest, or the way that students have experienced this, is things like you're a credit to your race, or being questioned. Did you really get an A on that exam? And that one is something that is really common, particularly for people who are Black, that people doubt that they were able to get a good grade on an exam, or even accused of cheating because they did so well. This actually happened to me in high school in my chemistry class. When I got the high grade, the teacher made a big scene and asked me if I had cheated on the exam. And that, of course, was deeply humiliating. Color blindness, when I look at you, I don't see color. And so this is just not a thing, as the young people would say. We do see people and we see differences among people. And that's not a problem. The problem is when you are looking at people trying to establish a racial hierarchy or a caste system. That's a problem. And what we're doing now is really, as a society, moving past that. But just putting color blindness in its historical spot. In the 50s and 60s and before, we were hyper-focused as a country on color as we're trying to figure out, who should drink at this water fountain? Where do we sit on the bus? What hospital can I go to? What part of the theater can I sit in? Like, that was a hyper-focus on race. And so color blindness was indeed 60 years ago an improvement on that. But one thing that we know is that it really isn't helpful for individuals or communities for you to pretend that you don't see some aspect of their identity because that aspect is unfavorable. As a mixed race person, I have had that happen where people are like, oh, I don't even think of you as Black. And it's like, that's not a compliment. That doesn't feel good for you to try to ignore some aspect of my identity. America is a melting pot. Sweet notion, not true. Segregation is just as real and alive as it has ever been in our country. And this creates barriers for us to understand each other and to take care of each other. So this is something that we need to acknowledge and to make some movements into making sure that we have the ability to understand and care for each other across identity groups. Criminality is the assumption that people who are Black and brown are more prone to crime and violence, which is not true. This is not true. Just because the media overrepresents folks of color in their news coverage or media coverage does not mean that. And the fact that people of color are stopped and frisked more often, are incarcerated more often, does not mean that they're committing more crimes. We know that people of color and white people commit crimes at pretty much the same rate. Incarceration is not an accurate proxy of who is committing crime. and violence. And so how this can look for individuals of color is being followed in a store, or being stopped for driving while Black, or having a white person clutching their bag when a person of color walks by. Denial of individual racism. This can also be denial of individual homophobia. I have a Black, Asian, Hispanic, or gay friend, so I can't possibly be racist or homophobic, etc. And this is back to people being complicated. Like, yes, you could have somebody from these identity groups that you care deeply about. Maybe you even love this individual, and at the same time harbor racist or homophobic notions about that group of people. The myth of meritocracy. This is one, again, Daryl Wing Sue talks about this misnomer, really, that if everyone can everyone can succeed if they just work hard. And so we know that success takes work. Every single person on the session has worked hard to get where they are. But the thing about it is the flip side isn't true. There are people that have worked just as hard as us, if not harder, and are not able to overcome those systemic and institutional barriers that prevent people from being successful. And that's the thing that we need to know. And then the other notion that the most qualified person should get into the program or get the position, that sounds good on the surface until we start digging down into what does qualified mean. We hear this all the time around admissions. We hear this with hiring. We want the most qualified person, or that person wasn't qualified, right? But here's the thing is, like, for admissions, there are some very clear criteria for qualified. You have to have a certain GPA. You are usually required to have a certain amount of hours, these sorts of things. That is the qualification for most programs. And so how are you saying that somebody is getting into the program without the qualifications, unless there's some hidden code about what qualified means in the minds of the decision maker? Qualified means that you look like me or behave like me, or qualified means that you have gone to a specific university. And I'm sorry to diss on some of our prestigious institutions, but we know that there are people that buy admissions or their legacy admissions into some of our prestigious universities. I can tell you that people who go to community college, they're not buying their way in. They're getting through because they are meeting the expectations of the educational path through community college and state college and things like that. So if you're thinking that qualified means that they've gone to an elite school, that's actually not necessarily true. So we need to really look at what we mean by qualified. The myth of diversity, this is one that I added. It doesn't mean that the value of it is a myth. We know the value of diversity, but the myth is that we had to lower our standards to admit students of color, or being told that you were only admitted or hired as the diversity student or the diversity employee. So the underlying message is, again, you weren't qualified. You didn't get here because of your merit. You got a freebie, whereas the rest of us had to work hard. And that is something that is invalidating. That is a micro invalidation in many ways, and can be deeply hurtful. And then pathologizing culture. So, this is something that people from the Black community feel like if they say anything or have an opinion about anything, people are thinking that they're too loud and taking up space. And then there are students or trainees from Asian descent that are considered too quiet. They're not engaged, they're not leadership material. All of those are stereotypes of groups of people. And so that can be an example of microaggressions as well. Things to know about microaggressions, they're not always consciously done. So if we think about microaggressions as being an output of unconscious bias, we know that people are sometimes saying things and they're not aware of the impact. You may be saying things, not realizing that what you're saying is having impact on certain groups. They're powerful because they're subtle and sometimes invisible, particularly to people that don't share that identity. For example, you probably know the way that you experience microaggressions, but you may not know the way that people from a different identity group experience microaggressions. So you might not even be aware that, yes, you are the recipient of microaggressions in one circumstance, but you're the source of them in another circumstance. For the recipient, it means that they are having a strong emotional response, trying to figure out what was meant, and then feeling like they have to figure out how to respond in that moment. And either responding or not responding both feel like options that are not great. So again, we're going to go over some ways to address those. I do want to talk for a moment about the impact of microaggressions. And one of the reasons that I do this is sometimes people say, well, you know, it's not that big of a deal. People should just have a thicker skin. You know, those sorts of things are not particularly helpful. And we know that there are actually health impacts related to microaggressions, particularly for people that are experiencing with some degree of frequency. So the literature shows that microaggressions are closely linked to things like depression and anxiety. And my own research has confirmed this as well. And, you know that one of the things that's related to anxiety and depression is suicide ideation and also suicide success. And I think that this is an underbelly that we don't talk about nearly enough in our academic learning settings. The suicide rate in schools of medicine is something that no school really wants to talk about, those rates, but they are higher. I mean, I would say that the only acceptable number is 0, but our numbers are higher than that. And it's also true for people that are working in healthcare. In fact, not too far away from where I live, there were 2 Black male nurses. The incidents were not related, nor did they know each other, but they both took their lives at the same time. Like that is just not something that should be happening. And it's hard not to wonder if that is related to the experiences of microaggressions. And then there's the physical health problems very much related to the mental health effects of microaggressions. But it's in the form of allostatic load. And if you don't know what that term means, it is the wear and the tear or the weathering of the body over time in relationship to stress. The biomarkers for allostatic load are the presence of stress hormones in the bloodstream and also hypertension. So if we think about what stress is supposed to do for us, it's a highly resource-intensive response to a threat in the environment. And the way that the body deals with that resource-intensive event is that we are supposed to go into parasympathetic mode where we rest and recover and regain our resources so that we can be ready to respond to the next event. So the problem is when people are stuck in the stress response, either there is not enough time in between events for people to really restore, or the body never gets the system that it's okay to turn off the stress system. Like if you know about how stress works, something turns it on and then something needs to let the body know to turn it off. So for many people, because of the chronic experience of microaggression or discrimination, that system is always on to some degree. So let's just talk about what that looks like in the different systems. So from the cardiovascular system, when you are in the stress response, you are experiencing things like tachycardia, increased contractility, conductivity, basically increased cardiac output so that you can respond to the stressors that are around you, right? And so that's fine and good in the moment when you're dealing with the stressor, but when it's chronic, it can look like hypertension. Hypertension is related to things like cardiomegaly, which is related to dysrhythmia, which is related to strokes and cardiovascular events. Why is it that people of color are at higher risk for hypertension, cardiovascular disease, stroke, and all these things? Could it be that allostatic load that they're carrying? Also under the stress response, the body is making available more sugar into the bloodstream so that you have the energy to respond to whatever is happening. So again, in the short term, that's great. I use up the sugar, I go and rest and restore. But the problem with a chronic state of that is it turns into something that is known as diabetes. Again, why are Black and brown people at higher risk for diabetes? Then there are things that take the back seat in the stress response. Our immune system. So what that can look like over time are autoimmune disorders. If you look at a lot of autoimmune disorders like lupus and rheumatoid arthritis, women of color are at highest risk for that. And then chronic illnesses, cancer, these sorts of things are related to your immune system. Your gastrointestinal and metabolic system, what does that look like over time? That can actually look like obesity. What does it look like when your reproductive system takes the back seat? That can actually look like poor maternal health outcomes. And why do we see that more in Black women than any other group in our country? So as you see these things accumulate, they're not just like, oh, that was a bummer, or oh, that was an uncomfortable situation. These actually have mental and physical health outcomes for individuals. And then the last point I want to make about microaggressions, for people who are experiencing that as patients entering the healthcare system, what do you think that's going to mean for them? If their provider is stereotyping them, making assumptions about them, the natural healthy response to being hurt or experiencing some sort of threat is to avoid that situation. So that can mean missed visits at the clinic. That can mean that people are not coming in to see us until they're really, really sick. And we know that once people are really sick, of course, it's harder to treat. So there's an overall healthcare system issue as well. There are social and cognitive impacts of microaggression. So every time a microaggression goes unchallenged and uninterrupted in any of our environments, that allows society to, basically passively devalue groups. And when we devalue groups, this actually impacts clinical decision-making. In our everyday lives, one of the things that we're doing is prioritizing. So if you have devalued a group of people, whether consciously or unconsciously, those are the folks that you're going to deprioritize just by default, whether it's people living with obesity, mental health, whether it is people that are struggling with substances, or whether it's based on an identity group, Black, white, trans status, any of those things. And then the final thing is that when people are trying to deal with microaggressions, that means that energy is diverted away from their prefrontal cortex, where they're, engaged in decision-making, being able to see the big picture, seeing connections, translating information from one setting to another, prioritizing, all of those things that we do as part of our executive function. The energy is moved away from that to the amygdala, which is now trying to keep you safe from a perceived threat, right? So it actually impacts our ability to learn and to make really great decisions. So we don't want that happening in our healthcare environments. So just one last sort of vocabulary check. Micro, in the term microaggression, does not refer to impact. What Chester Pierce was talking about when he coined this term was the daily common experience of it. When he used the term macroaggression, he was talking about things like lynching. For example, George Floyd, Breonna Taylor, Ahmaud Arbery, Elijah McClain, Jacob Blake, I could go on and on. These are folks that experience macroaggressions. Microaggressions can be deeply painful. They can be traumatizing. It can take only one and somebody is now having to process that for the rest of their lives. So they can be deeply traumatic for people, but they are not necessarily a macroaggression. So I just want to make sure that you're using the language as it was intended. So let's get into talking about the microaggressions triangle model. So one of the things that's important to recognize with the triangle model is that we have been on all points of this triangle model at some point. what we tend to think about when we think about microaggressions are the times that we have been the recipients of microaggressions. And we could probably spend, days talking about and processing and venting, bearing witness to each other's experiences of being a microaggression. And, honestly, we need spaces to do that. The interesting thing to me, though, is that those microaggressions are coming from somewhere, yet people have a harder time thinking about the times that they were the sources of microaggressions. And here's just the facts, is that everybody here today has been the source of a microaggression. And you will be again. I mean, that's just guaranteed. I would love to say that I am never the source of microaggressions. That would be so nice for my ego. It would feel great. It just simply isn't true. But how come then, if these are coming from somewhere, how come it's harder for us to remember when we've been the source of them? Well, there are several reasons for this. The first one being that if it truly is a product of your unconscious bias, you may not even be aware that you were the source of a microaggression. That's one of the things that I find haunting about doing this work around microaggressions. When have I been the source and not realized it? The other thing is that if you do become aware that you're the source of a microaggression and it doesn't align with your value system, if you are deeply committed to diversity, equity, inclusion, if you are deeply committed to being in service to other people, which is basically what everyone says is the reason that they entered healthcare, this is something then that can be painful for you to think that you have caused harm or hurt somebody else. And so your mind will, in its desire to protect you from that experience and protect you from a threat to your self-identity, will actually start to wall off that memory for you as a protective factor, to the point that you can actually even forget that that happened. The other thing that your mind will do to protect you is rationalize. We are experts at rationalizing for our own benefit. And so we begin to retell the story, and we can be so effective at this that we begin to retell the story in such a way that not only are we not the source of the microaggression, but we think that we're the victim of the microaggression. How dare they think that I was racist or sexist or homophobic? That doesn't align with my value system. And now you're upset, right? The other role then is the bystander role. And this is a really important role. This is the person that is the most likely to have more objectivity than either the recipient or the source, and may be the person that can step in. And it doesn't mean that you have to step in at this moment and have a zinger or something, but it means that this is a person who is in the best position probably to promote inclusion. Unfortunately, a very common response with a bystander is, I don't want to be involved. I don't know what to do. I don't know what to say, or I like to be friends with everybody, so I don't want to take a side and not say anything. And unfortunately, that approach, it seems like it would be neutral, but it's not neutral. There is no neutral in this situation. Anything that you say or do sort of has an impact, and doing nothing is actually doing something. So keeping that in mind. So for each of these areas, I'm going to go over underneath, like for the recipient, there is an acronym: ACTION, for the source, ASSIST, and ARISE. These are to help you figure out what sorts of steps to take. So we'll go over that next. So an example that I'm going to use is from my data. This is an African-American male nursing student that I was interviewing. We're going to call him Rick, and he was describing an interaction with peers after an exam. He said classmates were asking, okay, what did you get on the exam? And people responded, I got an A or a B, or I have to retake it, things like that. And I didn't even want to mention it, but I was specifically asked what I had gotten on this exam. And so I said, I got 100%. And people didn't believe it for some reason. Even though other people had a similar grade, everyone was kind of surprised that I got such a high score and didn't have to retake it. I can't help but wonder if it's because I'm Black. So we'll use that example as we're going through. So we didn't write the ACTION acronym, but I think it's a really wonderful one. Here's the citation for it at the bottom of the screen. The first one is to ask clarifying questions. This is a powerful tool. If there is in fact a misunderstanding, or what was sent is different than what was received, this is a great opportunity to get that figured out at the very beginning. I don't know about you guys, but like when people would come into the emergency room with changes in loss of consciousness, I loved it when we could check a blood sugar and it was a blood sugar, right? Because it can quickly be diagnosed and it can be quickly fixed. I think of this as that quick, easy intervention. If we can identify it, we can, fix the problem fairly easily. So asking a clarifying question, coming from curiosity, not judgment. So this is that moment where you just pause and you ask, why would an otherwise good and decent person behave in this way? This is a powerful tool. This doesn't mean that you let anybody get away with anything, but it gives you crucial information that you need to decide what next steps are. If the answer to that question is this person is ignorant, may not know what it's like to be a person from such and such social group, that approach is going to look different than this person is expressing anger, which is fear-based. That's going to be a different approach. This person was trying to connect and was doing it in a way that lacked skill and grace, right? All of those things require a different intervention, but you got to understand what you're working with before you just make an assumption about what somebody's intention was. You might tell what you observed in a factual manner. You might do impact exploration where you're sharing what happened for you in that moment, or you can take that a step farther and own your own thoughts and feelings. And then the next steps are going to be up to you based on how the individual responds to what you decided to do. If somebody's going to be really defensive, yeah, you might decide that you're going to avoid interacting with this person in the future. If the person's like, oh my gosh, I never thought of it that way, thank you so much for telling me, that again is going to be a different way for you to proceed with next steps. So it's important to understand that when a microaggression is happening, the recipient is in a difficult position. There are lots of things that need to be considered, and really it feels like in the moment that nothing is going to be a great outcome. And that's part of what makes microaggressions so difficult. And, for people that are trainees, residents, students, there's a power dynamic that you have to consider that is actually really real. So the first thing is to be careful not to respond in a way that makes the situation worse or even makes you seem like the aggressor, which is hard because you may be angry, legitimately angry in the moment. But I'm just going to say a couple names and see what this invokes for you. Chris Rock and Will Smith. I mean, that's just a classic example of, somebody is microaggressing. Somebody is the source of a microaggression, has historically been the source of microaggressions. Comedians are often walking that thin line. And I would say the Smith family had legitimate reason to not be happy with some of the things that were being said. And that could have been addressed, but Will Smith's behavior in that moment took the attention off of what Chris Rock had said, and he seemed like and was indeed the aggressor. So that's a fairly extreme example, but I see students doing this a lot. They're angry, they're upset, and they respond in a way then that their faculty or people in the community are saying, oh, they're not being professional. And that actually has consequences for folks. And so, I would like to tell people, if this is happening to you, we have rules against retaliation, that you should be safe in terms of your status. But I don't want to advise students in the world as it should be, but I want to advise them in the world as it is. So we really do need to look at what are the consequences in the real world of doing this or doing that. So you need to think about whether you're safe both physically and in terms of your status. And, being in an administrative role and seeing some of the interactions that happen, there are things that are difficult to take action to prove that there's retaliation going on. For example, someone poisoning the well and saying bad things about you. There's not a lot that can be done about that, yet that can be very harmful. a lot of the evaluations, grading of papers, things like that can be based on bias or can be leveraged by faculty in a way that it's really hard to prove that that's what's happening. And so I say that to say that when you are making a decision about how to respond to a microaggression when you're the recipient, we really want to make sure that we are responding with a real world instead of a world as it should be sort of scenario. So what can you do? I want you to know that addressing it at a later time doesn't mean that you're letting it go. Sometimes we need a chance to get out of our limbic system, the emotional piece of it, and get back into our prefrontal cortex so that we can really look at what are the consequences of this decision going to be long term, and am I getting myself to the place that I want to be in? You then may have the time to seek the counsel of a mentor or a friend, have some people that are able to advocate for you and support you through dealing with that microaggression. But you can also address it in the moment, like that is an option, but you got to think about what your motivation is. If your motivation is to call someone out and to have a gotcha moment, yeah, you may have the satisfaction of that, but that satisfaction only lasts for a minute. And if the situation escalates, it may make things worse in a way that's not to your advantage. So we just have to be really real about that. Reporting the incident gives the institution the opportunity to understand who are the sources of microaggressions and that maybe what kinds of microaggressions are happening, and to make decisions about that to make the institution more inclusive. So here are some things that you can do from the side of the recipient using the action model. So some things that Rick could say, just being 100% upfront. You seem surprised that I received such a high grade. Are you surprised? Just keeping it 100. Come from curiosity, not judgment. For example, I want to better understand your surprise. Can you explain that to me, please? You might tell what you observed in a factual manner. For example, I noticed when you asked some of the other students about their grade, you did not express the same level of surprise. Impact exploration might look like, ouch, your surprise makes me feel like people doubt my ability and my intellect. Or you can take that to the next step with owning your thoughts and feelings. You might say, it's difficult being the only Black student in our cohort. People often think I'm only here to fulfill a diversity goal. That's hard because I've always done well in school. Like, this can be a really powerful tool when people understand, whoa, never thought about that, didn't know that that was your experience. Or maybe they did know, but you're just bringing it right up to the forefront for them and everybody to hear. So depending on the response, if they are receptive and seem like they're folks that you can work with, it may be, let's go to class now, but I'm happy to grab coffee with you and, basically stay in relationship. Or if they're coming defensive, that that's somebody to avoid, or maybe even have a conversation with faculty or an attending or something like that. So let's talk about when you're the source of a microaggression. And so I think probably the most important thing is to acknowledge that whether you want to or not, no matter what your values are, you have bias, just like everybody else. We have bias that comes to us because we've made choices about certain things and we have opinions. I like a Toyota better than a Ford. I mean, that's a bias and something that people usually don't try to hide. But there are also biases that come in because we are taking in social media and because we watch the news or we watch television shows, and those things are curated for specific audiences and often historically stereotype groups of people. Chester Pierce, his first research around microaggressions was looking at television commercials to show how on a daily basis, African-American people were being depicted in a way that was derogatory, that they were never the examples of beauty in our society, that they were usually shown either eating or doing some sort of hard labor, right? They were never portrayed within the context of a family or within a profession, those sorts of things. So that is an example of what we have been soaking in over time about groups of people. So you have stereotypes. If you've ever watched a Disney movie, you have taken in scripts about what it means to be a woman in our society. What is the most important day in a woman's life has been depicted by Disney over and over as her wedding day. It's never the day that she graduated from medical school or from nursing school, right? We've taken those in. So you have bias, doesn't make you a bad person, but it does mean that you need to shine the light on that on a daily basis and be open to the fact that there are some things that might need to be rewired and reconnected in your thought processes. Seeking feedback and information. So this means noticing, you know, if you think that you've said something funny and people aren't laughing, notice, and then what happened there, like checking in with people. And then when people offer you feedback and you're getting that information, to really authentically listen to it. We are very quick to reject feedback. We'll say, oh, that person doesn't get me, or again, I'm the one that's being microaggressed at this moment, rather than taking a good look at that information that you've gotten. The next thing is to say that you're sorry. We have a terrible relationship with apologies, in that we, you know, part of it is that we are a litigious society. So we think that if we say sorry, that we're admitting to guilt or intent, versus the notion, like in Spanish, the term is lo siento, which from a technical standpoint means I feel it. And so what if that's what a sorry meant? That I'm in this moment with you and I feel this moment, I feel you in this moment, right? And so you can say what your intentions were, but the focus of the apology should be on the impact, acknowledging the impact that it had on someone. And if someone has taken the time to give you feedback, this is something that's a gift. And, you know, it's not easy to give somebody feedback, particularly around biases. So if somebody has taken the time, that means that they have some faith in your ability to hear it and to learn and grow. So if somebody has done you a solid and given you feedback, this is a time for you to acknowledge that as a gift and to say thank you for that gift that they've given. Some of the things I want to recommend caution is avoiding becoming defensive. When you become defensive, you are becoming the diva in the situation and you're making it all about you. So you risk having been the source of a microaggression and then making the recipient feel like they need to comfort you instead of you comforting them and you being accountable for your actions. We got to worry about confirmation bias. So we tend to take in information that supports our value system and then reject information that contradicts that, right? So our ability to take in information already has a bias. So just pause for a moment. And then also understanding commitment confirmation. So in essence, what this is we become more attached to being right than to understand the truth of what's happening. And then just that notion of thinking that there is a truth, a linear singular truth, is often something that comes out of our quantitative scientific, I'm going to call it scientific because it is a reductionist view of science, that there's one truth. And when it comes to human interaction, every human in that interaction has their real truth. And if you are really going to be a person that understands and can address microaggressions in an authentic way, you need to understand the truth of every single person that's in that interaction. That doesn't mean you let anybody get away with it, but you got to understand their point of view, and that for them, that point of view is the truth for them. So some things that you can do. The ongoing work of acknowledging bias. You can seek feedback. So in the example that I gave you, the source of the microaggression could have said, I noticed when we were talking about exam grades, you became quiet. How was that interaction for you? We've talked about apologies. One way that an apology could look in this particular situation is, although it was not my intention to harm you, I see how my questioning your score affected you. And for that, I'm sorry. And see how they acknowledged my questioning your score. It wasn't just a sorry or I'm sorry you were offended. By the way, that's not really an apology. That's blaming the person for being sensitive about it. But this acknowledges it and the apology is authentic. And then again, you could say, thank you for the feedback. I appreciate you taking the time to help me grow as a person. And the last piece then, the bystander model, is the ARISE approach. So A in ARISE means awareness of microaggressions. So this is, yes, you're aware of microaggressions as you experience them. You need to be aware that people experience microaggressions in different ways based on their life experience and their identity. And so you're just acknowledge that you're in a constant learning mode, and that every time somebody says that they're feeling a microaggression or have experienced this thing, that you believe what they have said and what they're telling you. And also, one of the things that happens a lot of times when somebody is expressing that they are that they've experienced a microaggression is that we tell them to grow a thicker skin. That if you're going to be successful in healthcare, you need to grow a thicker skin, which I think is a metaphor that is really off base. Because if we're going to use that metaphor of skin, you have no idea what somebody else's skin has looked like, what their racialized or identity-based traumas have been over time. You can be talking about open wounds that are happening. You can be talking about a ton of lacerations. We can be talking about scar tissue that is numb in some areas and really oversensitive and, you know, tingly and icky in other circumstances. So you really have no idea what somebody's skin looks like. And because somebody has a wounding in this area doesn't mean that they're a weak, oversensitive person. It just means in this moment, something has happened, and that the way that they can get to a place of healing from those past experiences is through being believed, through having human connection, and through having a network of people that can help them, you know, move through that microaggression. So responding with empathy, even if you don't understand how that microaggression impacted them, understand that it did. And we can also respond with empathy for the source, again, not in a way that lets them off the hook, but rather we ask, why would an otherwise good and decent person behave in this way? We can do inquiry of facts, try to figure out more information. Usually the inquiry of fact, it's not so much that we want more information, it's that we want the source to stop and think about what they said. You can use statements that start with I noticed, I wondered. And then educating the source about how that could have been a microaggression and engaging with the recipient in a way that lets them know that they have a caring, supportive community. So just some things, understanding that every situation is different. And there are things that you need to consider. Is this the time and is this the place? Sometimes it's not a great idea to, you know, call out your colleague about a microaggression in front of a patient. Or, you know, as a faculty member, I'm going to say that those times that I've been the source of a microaggression, I have very much appreciated students telling me during the break or over Zoom in the chat room privately, rather than saying, hey, Piri, I think that you might be racist, or hey, Piri, I think that you might be homophobic, right? Like that, as a human being, would be hard for me to really authentically engage and be able to take in that information and do the things that the student wanted me to do. So what would be the best way for preserving the relationships? If the microaggression is ongoing, how do we interrupt that in the moment and make it stop? I am going to go directly to the next slide of some of the things that we can do. In the bystander response with awareness, you could say, your surprise about Rick's score may imply a bias. Let's talk about what just happened, right? So that's a very, very direct approach. We've talked about with responding with empathy and avoiding judgment. What inquiry can look like. Can you explain your comment to me, or what did you mean by that? Again, it's about like having them reflect rather than gathering information. Another way that you could say it is, when you asked about Rick's score, it seems like you were questioning whether he was telling the truth. Is that what you meant to do, right? Statements that start with I, you might say, I noticed that Rick seemed offended when you made that comment about his score, and honestly, I'm feeling uneasy about it as well. And finally, you might say something to the effect that, I know you didn't intend to stereotype anyone, but as your friend, I wanted to let you know that what you said could be interpreted that way. So what I want to do now is open it up for questions